Alright, so we're first going to start with making up our controls. Alright, so we're going to go ahead and take 2 mLs of adult male into the positive control test tube right here. So, which is equivalent to 2,000 microliters. And we're going to take the packed cells. I am going to go down to the bottom. One. Two. And it also has to be a male with the normal hematocrit.
Okay.
Alright. And then I'm going to add 20 microliters. Of fetal cells. Alright, and then for your negative control, we just need to choose a male with a normal hematocrit. So we'll go ahead and use him again. So I'll go ahead and put, I don't need that much, so I'll go ahead and put some in there. There's no specific amount that you can put in for the negative control. I'm going to grab your pipettes. I'm going to go ahead and mix that positive control with those fetal cells. Okay, once we go ahead and make up our controls, we're going to go ahead and then make up for our smears, okay? All right, so what we're going to do is we're going to take 3 drops of normal saline. And put it in each one of these smear tubes. Drops of our prepared controls and put it in the appropriate tube. So this is 2 drops of the positive control. 2 drops negative control. And you can take it directly from out this tube. You just go all the way down into the packed cells. And you just put 2 drops in here.
So this part, what are you doing? You said put 2 drops of what in there?
The maternal blood.
Okay.
The patient
Patient blood. Okay.
Yes. Packed cells. Okay. And this is what we're going to use for our smear. Right here.
for the video.
So once you go ahead and prepare your controls and prepare your patient, you're gonna go ahead and come over here and you're gonna start to prepare your slides.
Okay.
So you're gonna do 2 positive controls, 2 negative controls, and 2 patient controls. Okay. And you can label them as positive, positive, negative, negative. And for your patient, you want to go ahead and put a little foot label for the patient on this side right here.
Gotcha.
Okay. So we'll go ahead and but you'll put that little foot label on it. So I'll just put patient right here. For training purposes.
You said put it on the other side or go ahead and put it on the right?
You put it on the patient, you put it on this side, which is fine, yes. With the patient information, you'll go ahead and put this little foot label right here, okay? Okay, so once you go ahead and label your slides, you're gonna go ahead and you grab a clean slide, and you wanna go ahead and grab 2 sticks, okay? And you're gonna dip it in here like this. And you go ahead and that same way as you used to do a sear in hematology.
Yep.
Make sure you put enough on there. I'm not good with slide making. But go ahead and take it, pull it back. Once you go ahead and fuse it, you just go forward and you're just making a regular slide.
Nice feather that. Go girl. That's a nice feather.
Thank you, thank you. Okay, and once you finish with it, you're gonna go ahead and you're gonna just kind of, you lay it flat. Don't hold it up, lay it flat. And it has to dry for at least 20 minutes,
Okay.
okay?
So,
These are slides that's been done. If you wanna go look at once you do those, if you wanna look at these slides, what you do is when you send them to the pathologist, you don't have to send all 6 slides, okay? You send the best slide from your negative control, your positive control, and your patient, the one that you actually chose, okay? So you can send the pathologist each one of those.
okay.
So this is the negative control, and I'll put negative on here. Ah. And this one, this is the patient. And this is for viewing purposes.
We sending the pathologist the positive and the negative QC slides too? Or
Yes,
just-
you send 1 positive slide, 1 negative QC slide, and 1 patient slide. You want to send both, you can send both if you want to, but you don't have to. The fixed solution, the buffer, and the stain, when you fill them up to the top, they only can be used once per patient. Okay, so you can't save it.
So that's why you conserve it. Okay.
Yes, you can't save it and then use it for another patient.
Got it. Because I see that.
Yes.
The mixture.
The mixture of it, and then the
Contaminate.
and then the stain color actually changes. After you use it for one patient, it actually becomes cloudy. Okay, is what it does.
Okay.
So you can't do more than 1 patient at a time.
No.
Okay.
I mean, you can. You just gonna have to dump that solution out and refill it up. Once the smears dry for 20 minutes, okay, you're gonna put 2 patients and 2 controls in the Copeland jars. You can put only 5 total in each jar. So, I mean, it's up to you if you want to try to do all of them or whichever the best looking slide is. Or you can do 5 and keep the 1 out here and just add the 1 after the fact. I mean, it's going to put you a little bit behind, but if you want to stay in all your slides, you can. It's up to you.
As long as it's that patient.
As long as it's that patient, as long as it's the controls for that patient. You can choose whichever slide looks the best.
Well, they yours do.
Okay? So you would go ahead and put, you know, you'll slide them in here, in the grooves. That's 4. And you can do another one in the back, which will make them 5. Okay? So it sits 5 in the groove. And you'll go ahead and let this sit for 5 minutes.
Okay. That's the first thing.
This is the first step. This is the fix it. Okay. Yeah, we just talking through it. Okay. So you put your slides in the fix it. You let it sit in the fix it for 5 minutes. Once you take it out of the fix it, you're gonna immediately dip it into the DI water. About 7-8 times. Okay. Once you do that, you're gonna go ahead. You can either have them sit up like this, and you can kind of let the excess water drip off, and then you can lay them flat. They have to sit for 20 minutes. Okay. After this step.
So we on the second 20.
We
Dry
on the
for 20
second-
minutes. And whenever you dip it after the fix it,
5 minutes.
and you rinse with the DI water,
Rinse DI.
another 20
Another
minutes.
20 minutes.
Okay.
All right, and once your slides are dried, you're gonna put it in the buffer, in the grooves. Make sure your grooves, put them in there properly. Just go ahead and stick those in there. All right, and then once you put them in the buffer, they're gonna sit for 8 minutes.
Okay.
Once those 8 minutes is up, you're going to immediately put it in a stain. No rinsing, no nothing. It goes immediately in the stain. Okay? Once you put it in the stain for 3 minutes, you're gonna take it out and you're gonna rinse it in the DI water. Okay? You're gonna dip it about 7-8 times. You can do right here. You're gonna tap it to get the excess water off. You lay it here and you let it sit there until it's completely dry. Okay? And then once it's completely dry, that's when you go ahead and take the slides, and you're gonna have to take it over there to the oil immersion microscope over in hematology. Okay. So once you do that, you're gonna look at all 6 of your slides, but you can determine which slide you want to go ahead and use, like to put your results in. One slide might be too clumpy and you don't like the way it looks, and then you take your second positive slide. That one might look better. Or you just gotta take whichever one looks the best. But for your controls, you gotta look at 2,000 cells, and it has to be at least 10 to 30 fetal cells total. Okay? In order for you to reach that 0.5 to 1.5% for your positive control. Okay? Okay. Now, so once you do all of that, and you look at your slides, you're gonna come to the computer. And you're gonna go ahead and come into result entry, which I don't have one right now, but then you're gonna go ahead and click on manual. You are going to click on config, and then you're gonna look for DMAN H right here.